Hey everyone, welcome to yet another episode of Talking to the Moon. We are in beautiful Boston today. It's fall and we are in a place called Cambridge Music Consortium. And it's my absolute pleasure to have with me Dr. Gargi Kakani. Dr. Gargi graduated from Harvard with a master's in public health, and right now she is a resident physician at Georgetown University Hospital. Did I get that right?
Yeah, MedStar Georgetown University Hospital.
Okay, cool. And Gargi has flown all the way from Washington DC. So thank you so much for doing that.
Absolutely. No worries at all. I was anyway going to come here to meet my friends. So I'm glad it worked out.
Yeah, I'm glad as well. And I'm really looking forward to this. And I had also flown all the way from Atlanta. And while I was flying, I realized that the mask mandates had been removed. I wasn't wearing a mask in my flight, which made me really think about the past 3 years that the pandemic has taught us. We have lived through some really unprecedented times. And especially Gargi has had a crucial role to play in all of this. One of the many healthcare workers or the frontline workers that played a crucial and an essential part in seeing us through this whole pandemic situation. I often feel that the whole pandemic started, it got over, so many things happened, and people took notice of so many things. People's lives changed, systems changed, but one thing that sort of went a bit under the radar was the contribution of healthcare workers. Uh, and today we are going to talk about that. So let's get started.
First of all, thank you so much. You make it sound like I've done like these amazing things in life when in fact I've just done my job. That was my job at the time. So it isn't like, oh my goodness, no.
Yeah.
It's just like, okay, she's doing her job.
Yeah.
Yeah.
Yeah. But still, I mean, that job is priceless, I would say, because when you graduated from GMC Nagpur, which is Government Medical College Nagpur, you were supposed to do your job, which is join the government hospital for your internship, I believe.
So when I graduated, we had signed a contract with the government of Maharashtra.
Mhm.
Yeah. In exchange for subsidizing our medical education. We have to serve the government for a period of 1 year. And when I graduated, that's when the pandemic hit.
Yeah.
So I chose to work in the largest dedicated COVID-19 critical care center in Mumbai.
Okay.
And that was purely because I am a Mumbaikar at heart.
Yeah.
And I'm like, oh, it's for Mumbai. Yes.
Yes.
Like I can do anything for Mumbai.
That's the spirit. But you said you chose to do this, so
Yeah.
you weren't assigned. You chose to actually be a frontline worker.
Yes. So we had to apply. I had to apply to the post and get interviewed to actually start working there.
Okay, I see. But Gargi, when all this began around March 2020, even though you chose to serve the government hospitals, you had no clue what was in store for you. The rest of the world, including doctors, researchers, nobody had a clue what was in store for all of us. So what was your mindset like when, of course, you mentioned that you wanted to serve your city, which is very noble, but apart from that, what was your whole mindset about perhaps the future or the uncertainty that was prevailing at that time?
So actually, funny story. I was in Philadelphia when the pandemic was truly announced.
I see.
Until then, until like 11 March 2020, it was public health emergency of international concern. And even though it should be taken seriously, nobody was officially calling it a pandemic. And I was in Philadelphia. I took the last Vande Bharat flight to Mumbai.
Mumbai, yeah.
So Newark to Mumbai.
Right.
And I was so upset because I had this amazing opportunity in Philadelphia and I want to like make the most
Yeah.
of that opportunity. And, I'm speaking to my parents and they're like, I'm telling them, it's gonna go away in 2 weeks.
Oh, okay.
Yeah. And I'll be fine, I swear. And this opportunity was only like 2 months long. So they were like, okay, if you think it's gonna last for 2 weeks, why don't you come right now?
Yeah.
Be safe. And then you can
Go
fly
back.
back.
Yeah.
Like, we will pay for your ticket.
Right.
And I was like, this is absurd. You guys are not understanding my feelings.
Yeah.
But I was so upset.
Yeah.
And then I reached Mumbai. I was quarantined for 14 days.
Right.
And then after at the end of my quarantine period, I told my parents that this is what I want to do, and they're like, absolutely not.
Oh.
Yeah,
Okay.
they were like, no way, you're not
Okay.
doing this. And my dad was a frontline worker.
As well.
And he's like, listen, I'm already going out there,
Yeah.
You don't need to. And I was like, listen, if you are going out there, then I definitely need to
be there. Okay.
Because he's not a doctor.
Right.
But I was like, no, I'm going. And then he's just like, okay, we'll talk about it tomorrow.
Yeah.
And then every day for like 2 weeks, I told him, please, Dad, please, Dad. And just for 2 seconds every day at dinner, I would be like, puppy dog face.
Yeah.
And then he's like, okay, fine.
Okay.
He's like, fine, do what you want.
Yeah.
If you want to do the COVID duty,
just go for it.
Go for it.
Okay.
And so at that time, I was just like, oh, this is like some, like, healthcare workers are needed at this point. And that's what I'm going to do. I didn't think much about the future.
Right. Okay. So that was your whole mindset before jumping in.
Yeah.
Okay.
I was like, oh, I'm young. I have no health issues. I can do it. I'm a strong, independent woman.
Yeah. But so when the actual process, when the actual duty began, I'm sure it must have slowly ramped up in terms of the seriousness, in terms of the number of patients, in terms of the volume of work you guys would have to do. So how were the first few days of those serious situation like? I'm sure you must have been given PPE kits. So how was that whole first initial phase like?
I had done a lot of research on PPE kits and how to wear them, and so that wasn't an issue for me, like the training part. Right. But actually working there, look, Mumbai is hot and humid.
Yeah.
And then wearing the PPE kits.
Yeah.
And working at a public hospital which does not have air conditioning and could not, it does in certain areas, but could not have air conditioning because of COVID, because of transmission of COVID. And so it was not a fun experience. Initially, like 2 months into my duty, I was given the task to handle an adult male COVID ward, all on oxygen, 25 adults.
Okay.
And I'm the only doctor there with a third-year nursing student.
Oh, God.
So initially, because of the fear, because of the uncertainty, a lot of people were hesitant to come out and help, even though they had the training. And I think in the beginning, everybody thought that, oh, I swear it's going to go away in 2 weeks.
2 weeks, yeah.
No, 2 months. No, it's just another 2 weeks.
Months. Yeah.
Like everybody had that hope.
Yeah.
And then I think it was probably like, until like Diwali of that year, people were like, okay, this is
here to stay.
Yeah, this is here.
So what was your typical day like, and like what were your duties?
So our day started very early. Because we were given only one PPE kit per duty.
Okay.
We couldn't change in and out of the PPE of the same kit often.
Okay.
So we went for 6 to 8 hours without meals, without toilet breaks, without water breaks.
Wow.
Double masked, and this was all in the ICU with like I wear
Glasses,
glasses,
yeah.
so like my glasses and the airtight goggles, so like everything is fogging up.
Yeah.
And this is Mumbai, so we're all
Wow.
sweating.
My God. So let me get this straight. So every day you can wear only one PP kit. Once you start wearing it, you can't take it off.
Yeah,
You can't have meals, use the restrooms, and all that in Mumbai heat.
yeah.
I mean, I can't even imagine. Like, it must have been really hard, right?
It was. And in fact, like I also want to emphasize
Yeah.
that there were nurses who were really, really supportive, and they would tell us, you haven't eaten in this
Yeah.
long.
Yeah.
I have an extra kit.
Right.
So if you want to
Oh,
go and change
yeah.
and like get something to eat,
Yeah.
and when you come back, I'll give you this extra kit.
Right.
So yeah, that was very helpful.
That's really sweet. And uh, let me play the devil's advocate. Let's say someone has their period or something. Even then, they can't go and change.
No.
Oh God.
No,
Oh, no.
unfortunately, no. I have had numerous stories of women, frontline workers, who just bled through their PPE.
Wow.
Yeah,
My God. Okay.
unfortunately.
Right. And then so you do the whole drill throughout the day, and then when do you have your first meal then? When do you use the restroom? Like after everything's done?
Yes.
Okay.
Or like before the shift starts or after everything is done.
Wow. Okay.
Yeah. So it isn't it shouldn't be okay. It
Right.
shouldn't be normalized.
Right.
But at the time, we needed to give PPE kits to nurses,
Right.
to lab technicians,
Right.
to mamas and moshis that clean the hospital, and it was just a tough time, like
Yeah.
overall.
Yeah.
And actually, there was this one time where it was so hot in June, and the duty that I was on at the time was taking care of newborn babies born to COVID positive mothers. And it was the only hospital that would accept COVID positive
Mothers.
yes,
Expectant mothers. Yeah.
correct. And so it was filled with babies, and it's hot, humid. I haven't had a sip of water, and I fainted.
How? On duty.
Yes,
Yeah.
on duty, and I fainted, and the nurse, like, because it's the nurse had to take my mask off.
In a COVID positive ward.
Yes.
Yeah.
Because I was so dehydrated.
Yeah.
I was so exhausted.
Wow.
Yeah, and the duties were like 7 days straight.
Wow.
And then we had some time off, and then
Yeah.
7 days straight.
Wow. So this must have affected people's physical health a lot,
Oh yeah,
right?
yeah. Oh, I mean, for sure.
Right.
I lost a ton of weight, and I'm
Yeah.
anyway really skinny.
Yeah. Yeah. Oh, wow. Okay. It's very hard. I mean, it's very scary almost to think of that. Gargi, we spoke about how this must have been very physically taxing for frontline workers to wear these kits hours on end, not take any breaks. But I'm sure it must have also been emotionally taxing, right? Because you're surrounded with people who are ill with an illness no one knows anything about, and people could be dying, and it could be get really serious. So how was that aspect like, the emotional part of it?
It was tough. I'm not gonna lie. I'm not gonna sugarcoat it.
Right.
It was tough. And I wouldn't say it was tough just for the frontline workers. It was tough for, families who were at home or who were quarantined, and, with a family member in an ICU that they
Right.
cannot see, speak
Right.
to, meet.
Yeah.
There was a lot of sequelae in terms of impact on mental health. I unfortunately had the the experience of telling a lot of people that I personally know outside of the hospital that, hey, I'm really sorry that I lost your loved one.
Yeah.
Imagine, Rohit,
Yeah.
if if you know somebody, like,
Right.
a
A
friend,
friend, yeah.
and you tell them, and you're the one to break the news.
News, yeah.
And this happened not with one person, but like with many people.
Yeah. And often patients look up to doctors as their only emotional support during these times because they are the ones who have the knowledge. They are the ones who can actually make them cure the illness. But you've also often spoken about, despite having knowledge, there are maybe not enough resources. Is that something you want to elaborate on?
Yeah, it's like COVID was a unique situation because we, as frontline workers, did not really have the full picture of what COVID is and how
Right.
it was evolving. And
Right.
evidence was changing on a daily basis.
Hmm.
So every day, like 500,000 new medical literature would get published, and we have to take decisions or change our protocols on the basis of those.
Yeah.
Every day. So one day, one protocol says, oh, we should give hydroxychloroquine, and then
Right.
overnight it changes, and then it goes to, let's give remdesivir,
Yeah.
or let's do, dexamethasone,
Yeah.
and these random medicines
Yeah.
we're just throwing at the patients, hoping
Yeah.
that something sticks.
Would work. Wow.
I'm sure you might have heard of the cytokine storm. And we know what to do in terms of cytokine storm.
Right.
But, we don't always have the resources. Or
Yeah.
like, for instance, if somebody needs a ventilator for, to help in breathing. And I know that this patient needs a ventilator, and this patient is like 30s, 40s,
Right.
and with a ventilator,
Yeah.
he can recover and have a normal life.
Yeah.
But I don't have those resources.
True. Yeah.
And so in the first few months of the pandemic, I would say the first 4 months, it was extremely difficult because the mortality rate at the hospital where I worked was really high. It was really high. So it was like, I would literally pray to God, please don't let anybody die in my shift.
Yeah.
Like, I just do not want to be the person breaking the bad news.
Yeah, I can imagine. So it's physically taxing, emotionally, mentally taxing. And the thing is, you don't know when this will end, right? And it has just begun. There is too much uncertainty. Were you at times thinking of like giving up? Were there days where you just want to like run away from all of this and just like give up?
Initially, no. Initially, I was very strong and head fast, and I was like, okay, bring on the challenge.
Right.
And then, as time went on, and I was stuck in this routine of sameness.
Right. Yeah.
I don't know if you've heard of this mythology, Greek mythology of the tragedy of Sisyphus.
Yeah. Yeah.
Where he is cursed to roll a big boulder up a hill. And as soon, like just before it reaches the peak of the hill, the boulder runs down.
Oh.
And so Sisyphus goes back down and pushes it up again.
All the way. Okay.
But, he is not able to reach the peak.
Oh.
And the task for him is to reach the peak.
So you felt like that?
I felt like that. Because it was like, when is this going to end? I felt like I was doing the same thing day in and day out.
Yeah.
And just when the numbers were starting to decline and the world was opening up, boom, another
wave. Yeah. Yeah.
So I was like, this is God. Like, I was so tired. I was like, okay, enough.
Yeah.
Yeah.
Yeah, I can imagine. And you have spoken to me a couple of times about how difficult this was, but there was still some sort of emotional and maybe mental, material support from your family.
Oh,
which comes.
Absolutely.
Yeah. But I often wonder, not everyone would be as perhaps privileged as this, if I'm using the right word.
No, I agree with you.
Yeah. How did your family support this? And perhaps maybe that was another reason you didn't feel like running away in the end.
Yes, I think my family played a huge role in like just supporting me through this time. Like my routine was whenever I would come back from a COVID duty, I would drive up my car. So first of all, wait.
Yeah.
Since you've said privilege, I was privileged enough to own a car
Right.
and to know how to drive it.
Yeah. And also stay in the same, like your house was in Mumbai as well, right?
Yes. Yes. So I lived with my parents during the time because they said if you are going to take care of patients, then we want to take care of you. So you come home, you eat fresh food, we'll cook for you, maintaining all the distance, whatever is possible and feasible. But my parents were like, okay, if you want to do this, then you have to follow 1, 2, 3 rules, and this is how it's going to be. So I was in a routine. So I would drive up my car. I would have like bottles of sanitizer and sprays in my car. So I would clean the car, and the security of the colony was instructed to not be near me, like not like be near the elevators when I've arrived. And so they would just press the floor and leave because I was not even allowed to touch the buttons. So they would press the floor and leave, and they would intercom my parents or my mom that, okay, she's on her way up. So when I go home, I don't have to press the doorbell. They know that I'm coming. So my mom would open the door, and I would take like a bag with bottle of water and like, just some things.
Essentials.
And so she would spray the bag down. And I would, like, even my glasses, she would spray my glasses down as well. And then I would, just at the entrance of my door, there is like a bathroom. And so before I enter the house, I would go to the bathroom. I would like soak my scrubs. I would shower. And as soon as I've left that bathroom, there's a hot plate of food for me at the dining table. Like every day for 14 months, this was the routine. Every single day. And if mom is busy, if she can't do it, then it was my sister-in-law or it was my brother. But like and this was the routine for my dad as well. So whenever he came back from work, all of his stuff would get sanitized. And he got so annoyed because he would carry like papers. And like those papers would get
also sprayed. I see. Wow. But I mean, that's really commendable. And it's families like these, and I'm sure not just families, any loved ones, friends who supported frontline workers also had a small hand in contributing. A big hand, big hand.
I don't think I could have done what I did for 14 months without especially my mom's support.
So, but I'm sure this affects mental health of doctors, nurses. How do people in the medical profession themselves take care of their own mental health? How is it viewed in that setting?
Oh, this is my favorite question. I want to roll up my sleeves.
Yeah, we are all yours.
It is stigmatized. More in India, less in the US. And it is stigmatized in the way as if you can't take care of yourself, how are you going to take care of your patients? Or it is viewed as, you're being so weak. Or it is viewed as everybody goes through this. Like it is normalized. Like everybody goes through this. Why are you being soft?
Got it.
Right? This is not true for where I'm getting training. Like my colleagues are like, oh my god, if you need help, let's
take all your time.
Yes, and like they like help you out, support you.
Right.
But the shift is that in India, even outside of medicine,
Right.
mental health is stigmatized.
Yeah. Outside medicine, I can still understand because people don't look at it as a medical condition. But I'm surprised that doctors who have studied perhaps in their own syllabus
Yeah.
would look at it in a more sort of negative way.
Yeah.
That's very interesting. So, do you think there are any systemic changes needed for mental health, especially for frontline workers or just doctors?
Absolutely.
Okay.
Yes, I think we need to be, and we need to be more understanding, more warm, and more the onus of maintaining your mental health is shifted from the hospital administration to the resident physicians.
Right.
So what is encouraged? Oh, take some time off and meditate and do yoga,
Yeah.
exercise, eat healthy.
Yeah.
But if I am working for 12 to 14 hours,
Right.
do I have the time
Exactly.
to exercise, to eat healthy,
Yeah.
to take some time
Yeah.
off?
True.
I don't, right?
Yeah.
So it's
like the environment is not created by the system for you to actually take care of yourself.
Correct. And then they tell us, oh, you are responsible for your own mental health. It's like victim blaming.
Yeah, true. So do you think policy level changes at perhaps various administrative levels are needed, or perhaps it should be more of an individualistic change which should bring about a general work culture change amongst people? What do you think of this?
Policy can change 1,000 times over.
Right.
But the true change has to come from within.
Okay.
So people who are actually working in the hospitals have to say, okay, I don't like this work environment. And even if I have been treated in a wrong manner,
yeah,
I want to change it.
Yeah.
And I want to make it better.
Yeah.
And the system has to change from within.
Yeah.
No policy change can affect it from outside, because people who are making policies often are not working in those environments.
That is true. Yeah. Yeah, I agree. And you rightly mentioned about breaking the chain of sort of tyranny or breaking the chain of unfairness, because I know a lot of people who, I believe people in their first year of residency are sort of overburdened by people in their third year or something like that. And this is like a very recurring thing.
Yeah, this is true in India.
In India, yeah.
Yes.
But then that's where the whole breaking the chain thing comes, right? Because if the third year people don't sort of bully or whatever, the first year ones perhaps won't do that. So what do you think of this whole situation?
I mean, yes, oppressed often becomes the oppressor.
Yeah.
And that's why I say that it has to come from within. It has to, like for instance, in our parents' generation, women were not given opportunities as men.
True.
And then somewhere, there was a revolution, and our parents' generation, like our mothers, decided, okay, my daughter is not going to go through this.
Yeah. So you're saying individual mothers, when they or women decided to bring their change within themselves and propagate it further, that's when it collectively became like a revolution.
Yeah, like a cultural shift.
Cultural shift, right?
Yeah.
Not necessarily by policy, but by people themselves.
Correct.
Okay.
Yeah.
14 months of COVID frontline work, hundreds, thousands of patients. I'm sure you must have had positive and negative experiences, a range of experiences. Any things you would want us to know? Any such experiences?
I think they're all unfortunately kind of sad.
Okay.
And so negative experiences, I already told you that
Right.
I had to,
break the news, yeah.
Yeah. One of the positive experiences, I don't even know if I would call it positive.
Right.
So this newborn baby born to a COVID positive mother was preterm, which means that they were born at less than
9 months.
yes. And they were actually, this kid was 7 months old. And COVID during pregnancy did lead to preterm deliveries.
Okay.
So we know that it was because of COVID.
Right.
And we tried to, this kid had a lot of complications just because of being premature. And we tried to do everything in our power to make the child better or just make them more comfortable. Eventually, the baby passed away, and parents were obviously distraught.
Yeah.
And they were breaking down. And while the mom is crying, she holds my hand and she says, "Thank you so much for doing everything."
Wow, like.
And in that moment, I was like, oh my God. Like, I was just like...
Yeah, because I mean, their whole world has fallen apart. You perhaps might be the last thing on their mind, and rightly so.
Yeah.
And yet she had that moment with you. That's incredible.
Yeah, she's just like, "Thank you so much for trying."
Yeah. Wow. So are days like these the ones that keep you going? Because 14 months of sheer resilience, and as you said, it was like a clockwork, and there are chances of burning out.
I was burnt out.
Yeah.
Oh yeah.
Yeah.
I was burnt out.
Right.
Yeah, but I kept going because I am so madly in love with medicine.
Yeah.
I think of medicine as a person.
Oh.
And like a person is flawed.
Right.
Like has positives and negatives. You have
yeah.
like great experiences, but also sometimes they annoy you.
Yeah.
So I think medicine
Is that person?
Is that
for you?
person?
I see.
Yeah.
And you decided to take your relationship with this person forward by coming here to the US.
Yes.
What prompted that decision? Was it the conditions in India? What was your mindset?
No.
Okay.
Actually, I am really interested in research, and India is still very nascent in terms of clinical research.
I see.
So, clinical trials are something that happen only in really well-funded institutions, or it's very difficult to get good clinical research training. In addition to the clinical training, I think that the physicians of India are, in my very biased opinion, world class.
Yeah, and why not? Yeah.
Yeah, but it's purely because of research, and I just think that another reason why I chose to come to the US is because of the workplace environment that I was talking to you about.
Yeah.
Where I need to be in a positive work environment.
True.
Because I'm a soft heart. Like if you yell at me, I will start crying.
Okay. Yeah, that's not happening in this podcast. Yeah.
So it's like I don't think I would have survived residency in India. But those who are doing it, kudos. Mujhse to nahi hoga.
Mujhse to nahi hoga.
Yeah.
So you decided to pursue Masters in Public Health, which I believe is extremely misunderstood. Even I didn't quite know what it really means, and I was like, why are people who have MBBS degrees from India coming and like changing their field? I used to think it's about community health and urban health, but please enlighten me and others who might have such notions.
Actually, that is so true. When I told my colleagues in India that I was doing Master of Public Health in the US, they were like, community medicine?
Yeah.
Why are you doing community medicine in the US? You can do community medicine here.
Yeah.
And I was like, no, that's not what Master of Public Health is.
Right.
I think MPH is a misnomer or is just unfortunately misunderstood.
Right.
there are people who do, say, fashion design perhaps, or they have their own restaurant and then they go and get an MBA. And that MBA could be in anything. It could be in strategy, finance, family business, hospital management.
True.
MPH is the same thing.
Oh.
So lawyers, businessmen, social workers, anybody, nutritionists, nurses, anybody can do an MPH.
I see.
And the MPH tracks, like I said, MBA in finance is a track.
Oh, in MPH.
So then MPH also has a track, multiple tracks. So the track, like, there is MPH in health policy. There is MPH in epidemiology. There's MPH in biostatistics.
I see.
So the kind of MPH that I have done, it's called clinical effectiveness, which makes doctors better doctors.
Oh, I almost see all the threads we talk about come together. Yeah, pat yourself on the back, you deserve that. We spoke about working conditions. What could perhaps make better doctors is better working conditions, and it's like a cycle: better doctors, better working conditions. And we spoke about research, which I'm sure is also part of your MPH.
So actually that's true. Because Master of Public Health and Clinical Effectiveness, it does train clinical professionals to become better clinicians in the way that they judge for themselves the medical literature, whether it is applicable in their patient population, and what are the pros and cons of the evidence that is published. So just because it's published does not mean that it's true or it's right or it's not right. In either way. So
got it.
You have to be critical of everything and you have to make that decision yourself. That decision making cannot be transferred onto the author of the medical literature.
I see. Makes sense.
So that is the reason why I chose to pursue Master of Public Health in clinical effectiveness, particularly, was because during the pandemic, even though I did not agree to prescribing hydroxychloroquine, my professors, my seniors were like, no, this is the protocol, and so we are going to do it. And I was like, protocols can be changed.
True. They were set by people.
Exactly. Protocols can be changed. Medical decisions should be backed by evidence. So if you think that hydroxychloroquine works because it was published in like a cohort of 50 people in China, it doesn't make it true. Their culture is different. But also, was the study done well? Was there enough sample size? There are these
so many factors.
Exactly. Or was there any bias in statistical analysis? What kind of statistical analysis was done?
Performed.
Was it a type 1 error, which is like a false positive result? There are all of these factors that play. And I was like, I just don't agree with this. I saw the downstream effects of it. Because I'm in there with my patients for like days on end. And it's like, I know them. I know their like family histories. Right? And so I was just, that's the reason why I was like, I need to know how to critically evaluate medical literature because nobody's going to teach me. They should include that in the curricula. It is there, but they don't teach it well. For sure. They don't. I can
guarantee.
You can come at me if you want to, bro, but I don't think it's taught well.
I see. So what would your advice be for people who want to pursue masters in public health in the US? Is there something they should think about first before actually jumping in? Anything?
See, if when somebody gets an MBA, they are doing it to advance their career, right? They are at point A, and they want to go to point B.
Yeah.
And they want to make that transition quickly.
True.
What are you hoping to achieve with a Master of Public Health? Right? What do you want to do? Like how will an MPH help you in your career?
True.
Don't get an MPH just for getting an MPH.
Yeah.
It is very difficult.
Yeah.
It involves a lot of math, a lot of biostatistics.
I see.
And a lot of like coding, software, and
wow, a lot of math and coding. That's interesting.
Yeah. And coding as in not like
not program writing, but statistical analysis.
Yes. And my MPH was like, I know what to do.
Right.
But in this software, how do I write this code?
Yeah.
And so I'm googling the code, and then I'm like, okay, I'm changing the variables.
Yeah, so it's not a cakewalk. People need to have a purpose when they actually write the statement of purpose for applying to universities. And become friends with biostatisticians. Okay, noted. And you were at Harvard, right? How was that experience like?
It was amazing. In India, we go from 12th standard to med school. Yeah. We don't have that,
4-year undergrad,
yeah. So I substituted that in like my 4 years of pseudo undergrad was basically my 1 year of grad. Okay. It was a lot of fun. If you are deciding between other universities and Harvard, choose Harvard.
Yeah, very biased opinion, but I want to agree with her regardless. That's amazing, Gargi. And one last question. In these past 14-15 months, you've gone through the whole COVID journey, you've come here, gone through MPH. What have you learned about yourself, about life? Very philosophical, I know, but...
How much time do you have?
I see. Anything you can wrap up in like 2 minutes. I know, very hard task.
2 minutes?
Yeah.
Jeez. Okay. What did I learn about myself? I learned that I was too hard on myself.
Before,
Yeah. For me, it was like everything has to be perfect because we are dealing with human lives and there is no room for error.
Yeah.
Which continues to be true, but accepting that we are instruments of medicine. We cannot wish and it'll happen. We cannot manifest things.
True.
And we work very, very hard.
Yeah.
So I think just reinforcing self-care.
Yeah.
And reinforcing being kind to yourself. Like you've had a bad day. And I see all of these things, right? But then I go home and I'm like, today was such a bad day,
Yeah, I know, it's hard to implement it.
Exactly.
But I think just the fact that you're aware of it, I think that's half the job done, because people, I believe, are not even aware that these things should be there.
And I think it has taught me a lot about relationships. It's taught me the kind of support system I need in my life to do my job well.
True.
It's not very easy to support somebody who has to go to work, reach work at 6 a.m.
Yeah.
Or they're working for long hours, or they're going to be called for
emergencies. True.
And they're going to be missing family, gatherings.
Yeah.
It's very difficult.
Yeah.
So it's taught me a lot about relationships. It's taught me a lot about the kind of family that I want to have
in the future.
Right. So having a good support system, having somebody who understands
the ins and outs of your job.
Yeah. And while I also speak about the mental health of frontline workers, there is a huge aspect of mental health of the
family
support system.
Yeah,
which I have not addressed.
Yeah.
But
I'm sure
imagine, my mom she's like, okay, so my husband is going out to
frontline work.
Yeah, and my daughter. And it's they're in their
50s. Yeah.
I'm pretty sure she's a very strong woman,
Yeah.
so she was able to do it well.
Yeah, but even the strongest people need support sometimes.
Yeah.
I agree.
It's you know it's life. Sangharsh ka naam zindagi, you know.
Yeah, true. What better example than this? And now we are towards the end of our episode. This has been really amazing. I have learned so much about MBH, about your journey as a frontline worker. And
You know, thank you so
Yeah.
much for having me actually, because a lot of people outside of medicine are like, yeah, we know the lives of doctors or nurses really tough, and
Yeah.
you know, kudos to you, you
Yeah.
know, like hum thali bajane aa jayenge.
yeah,
But like very few bother to like,
dive deep.
yeah.
Yeah, no, I agree, and I think once we were talking, and I was said the same thing. I'm like, thanks to you guys, like we all have sailed through the pandemic, and you were like, more than a vote of thanks, it's this sort of deeper understanding and
Yeah.
empathy that people should have for frontline workers.
Yeah.
Yeah, so I hope I was able to fulfill at least some of that today.
Thank you so much.
Yeah, but thank you so much for again coming all the way from DC. This has been amazing, and thank you again. Yeah.
Thank you so much.
Yes. Keep watching Talking to the Moon. We'll see you very, very soon. Oh, that was a rhyme. Interesting. Cool. See ya. Bye.